and welcome to Health Live at Seniors Today. We are here on a Saturday evening and greetings on Independence Day. As always, we have a doctor in the house, and today we have Dr. Eric Borges. Eric Borges is a professor in cardiology and senior cardiologist at the Bombay Hospital Institute of Medical Sciences, an alumnus of the TN Medical College. Dr. Borges is a recipient of 13 prizes and gold medals in his career. He's also associated as a cardiologist in Mauritius and Tanzania at hospitals which have a collaboration with the Bombay Hospital. He has performed more than 30,000 angiograms, including coronary and paediatric cases, and performed over 7,000 cases of coronary angioplasty with and without stent implantations. Welcome to Health Live at Seniors Today, Dr. Borges.
Thank you so much, Pradyuman. Happy to be here.
Dr. Borges, on a lighter note, I must ask you, the number of angioplasties you've done is 30,000, which is like a huge number.
Well, it is. I've been in this game since 1974.
Right.
So, it's decades and decades that I've been doing invasive cardiology. So I don't think you should be surprised at that number.
Yeah, well,
there's so many cases in this country that need to be investigated and treated.
That's right, absolutely. So once again, welcome to Health Live, and so happy that you're here. I would request you to say a few opening remarks, specifically because we have a fair number of senior citizens here as attendees, and a request to all to post your questions at the Q&A tab. Some of you have sent them by email, which we will also address, and we will pose them to Dr. Borges. Over to you, Doctor.
Thank you, Pradyuman. I am actually very honored to be among my fellow senior citizens, because I too am a senior citizen. It's a very, very, humbling thing to reach the 6th decade, 7th, 8th, and 9th decade, because I think they are the most valuable parts and times of our lives. It is full of wisdom and, in a sense, lack of too much responsibility. I think we've kind of shed responsibility, as we have advanced in age. And that's a very wonderful thing, to be able to enjoy the last 1/3 of our lives without these onerous responsibility. Having said that, senior citizenship also brings its own challenges, in health particularly. And today I hope to be able to address some of these issues that are peculiar to senior citizens. I mean, all of us are aware of diabetes and high blood pressure and heart trouble, strokes, joint issues, breathing problems that affect senior citizens. So there is a whole branch of medicine reserved for the treatment of senior citizens, and it is called geriatric medicine. So people have realized that this is a very specialized subject to how to manage and treat senior citizens. As a cardiologist and as a physician, I see lots of people above the age of 65, which by definition, according to the government of India, probably would make you a senior citizen. And they have myriads of problems with their heart and blood vessels and so on. So, the list is endless, and I could go on talking till the cows come home, but I wouldn't like to bore you. So I think Pradyuman will pick up a few questions that you have asked, and I'd be happy to address specific questions which may be of interest and help to you sort out your problems. And at the end of it, as each question is asked to me, I'll pick up the important factors in those questions and dilate a bit about them so that you can pick up extra clues as we go along. So Pradyuman, please ask me a few questions.
Yes, I will. So a question from an anonymous attendee is, my family has a history of cardiac arrest. Can I prevent that from happening to me?
Well, that's a very, very good question. Now, if your family has a history of cardiac arrest, it is very important to figure out why these cardiac arrests occurred. Broadly, you can classify those situations as being genetic, in the sense that there is an abnormal gene that involves certain parts of the heart, particularly the electrical stability of the heart. So if you have that gene, God forbid, what happens is, out of the blue, you may be a very young person, you may be 10 years old, you may be 15 years old, you may be 25 years old, 50 years old. Out of the blue, suddenly your heart will go into a very chaotic rhythm. And because of it goes into a sudden chaotic rhythm, that chaotic rhythm does not allow the heart to pump blood. Your blood pressure goes down, your brain suffers from anoxia or lack of oxygen, and you just drop dead. Okay? This is what is called sudden cardiac death caused by a genetic influence, okay, where it involves the electrical stability of the heart. Now, supposing you have unfortunately inherited that gene. Number one, you'll have to identify it. And now there are ways and means of identifying that gene. Okay. Sometimes you get a clue on the electrocardiogram, on the regular ECG. Sometimes you can get a clue on a 2D echocardiogram. So of course, when you speak to your specialist, he will conduct the various tests that are required. And if, God forbid, you have some such genetic predisposition, then the treatment is very simple. We give you what is called an automatic implantable cardioverter defibrillator. So it's a small little pacemaker machine that we implant in the skin under your collarbone. The collarbone is called the clavicle. So it is implanted there, and the wires are threaded into the heart via a vein. So what does this machine do? This machine monitors your rhythm. If the rhythm is fine, the machine is asleep. It doesn't do anything. It just monitors it and is there as a standby. The moment it finds that your rhythm is becoming chaotic, it immediately springs into action. And in order to control that chaos, it administers a small electrical shock to the heart. By administering that shock, it abolishes that chaotic rhythm and the heart starts pumping normally again. So it is absolutely life-saving. Given to these kind of people, it's extremely good. So remember that it is treatable. Today we have treatment for these kind of unfortunate people. The other types of sudden cardiac death are those that occur if you have a sudden heart attack. You see, all of us have had that experience. You know, a person is otherwise fine, suddenly gets a massive chest pain or discomfort. And before you can, he reaches the hospital, he has a cardiac arrest and he passes away before he reaches the hospital. That kind of a scenario is completely different to the previous one, which I described. This kind of a scenario means that he's got a family history of heart disease, of what we call atherosclerotic coronary artery disease, thickening of the arteries, hardening of the arteries by deposition of cholesterol, etc. And when it becomes very critical, blood flow stops to the heart and the heart is damaged. And when it is damaged, you can end up with a massive heart attack, which leads to death. Those kind of individuals, they would have, if the family history is saying heart attacks at a young age, then you better get yourself screened. And for the screening purposes, you'll have to check for blood sugar, cholesterol. If you're a smoker, you better give up smoking. If you have a sedentary lifestyle, change the sedentary lifestyle. If you're overweight, lose weight, so on and so forth. Attend to all the risk factors. But assuming you've done all that, could you still have a problem? Yes, you could, because the gene, doesn't, the fact that you don't have any risk factors doesn't protect you from developing a heart attack if you have a strong genetic influence. So then what you have to do is to screen yourself with various cardiac tests. Could be a stress test, could be a nuclear scan, could be a CT coronary angiogram, to see whether you have any evidence of lack of blood supply. And if you do, then you have to improve the situation either with medication, angioplasty, or a bypass surgery. So sudden death is a very huge subject. I've just touched upon two of the common varieties that you see. And depending upon which variety it is, you have to give the specific treatment.
Thank you, doctor, for, I'm sure this has responded to most of the questions that have come in of a similar nature. We have a question from Mr. Narayanan Nair Ravindran, who says, who asks, I want to know for senior citizens, for a healthy heart, what is the role of cholesterol and what is the allowed limit to which we can afford? Any diet that can bring down cholesterol? There's another question from RDS Mehel, who asks, what should be a good average blood pressure and diabetic count for senior citizens in the age group of 78 to 85 years?
Okay, so I'm going to club these two questions together. Okay, so let us take the cholesterol problem. The cholesterol was a very bad boy all along. Ever since 1945, 1950, it was identified that these flatty blockages in the heart were made up of cholesterol. So immediately people started saying the cholesterol is the culprit. And they were right up to a point. Today, do we believe that? Yes, we do, but not as strongly as we believed it in years gone by. Have we become lax? No, but we now know that the word cholesterol doesn't tell the whole story. Cholesterol is a family, okay? So in a family, you have people who are very good, who are pious and saintly, and you have people who are badmashes. We all know that, okay? If you look around us, you'll see myriad examples of what I'm trying to tell you. Similarly, in the cholesterol family, you have the pious fellows, the good chappies, we call them good cholesterol. And you have the sinners, you have the papis, so to speak, we call them bad cholesterol. So you may have a very high good cholesterol. So your cholesterol is high, but it's high because of good cholesterol. In which case you should celebrate, because you're not likely to suffer from a heart attack, because the good cholesterol is protecting you. On the other hand, your total cholesterol may be high because of a bad cholesterol that is high. If that is so, you're in trouble, because sooner or later, that bad cholesterol, which is called LDL, low density lipoprotein cholesterol, is going to create havoc with your circulation. So then you are advised to lower that cholesterol. Okay. So therefore, cholesterol by itself doesn't mean anything. You need to get what is called a lipid profile test, which will split up the lipids into the entire family. You'll be able to examine the entire family of cholesterol and then decide what you should do. Large-scale studies on biochemistry of young people, middle-aged, and senior citizens have conclusively shown one thing, and that is The lower the LDL cholesterol, the lower the bad cholesterol, and the higher the HDL cholesterol, the better it is for any and every human being. Okay. Now, supposing you're a person who has no high blood pressure, no diabetes, you're lean and thin, you exercise regularly, you do not smoke. So, in a nutshell, you have no major risk factors, so-called risk factors for the development of heart trouble. We will accept a cholesterol level a little higher, a bad cholesterol level a little higher than we would have accepted in a person who is obese and who's got high blood pressure and diabetes, etc., etc., etc. So, what is the safe level? If you don't have multiple risk factors, then I would say that if you have your LDL cholesterol around 100 milligrams %, you are fine. If you have one or two risk factors, that is, say you are overweight and you've got high blood pressure, and you want to know what is the safe cholesterol for you, bad cholesterol, LDL cholesterol for you, I would say go down to 70 milligrams %. But supposing you've got every risk factor that there is, okay, then I would say go down further, go down to 35 milligrams %. So you can see the range is wide. You have to tailor make it to suit the individual person. There's no one number fits all. Okay. Now, in order to get this cholesterol down, we were coming about to a diet. Okay. Before, it was believed that animal fats, like red meat and all the other stuff that we have been brought up with, was very, very bad. And if you had all that, your cholesterol would go through the roof. Not true. Okay. We today know that that was a bit of a hyperbole. So it is no longer believed that all these things are terribly bad and are banned, anathema. No, that is not true anymore, because if you don't have a certain amount of those kinds of fats, what we call saturated fats, your body will produce them. So you can give it from outside or your body will produce them. So today we know that having a very, avoiding all those things is not necessary. The age-old advice that my grandmother, and I'm sure your grandmother and grandfather gave you, was eat in moderation, eat sensibly, still applies today. But having said that, there are some foods which protect you, which actually offer you protection. And those foods are those that are very rich in omega-3 fatty acids. You may have heard of this, omega-3 fatty acids, which are found in walnuts, found in flaxseed, and for those who eat fish, in fish oil. So if you consume more of these, it is cardioprotective. Otherwise, the best diets to have is what we call the Mediterranean diet, okay, which is high in fruit, high in green leafy vegetables, high in nuts, and high in fish. So if you have this, that's the best diet that you can possibly consume. That's as far as the diet is concerned. Now, there was a question was about diabetes as well. Now, let me tell you, this is one disease that has taken a complete somersault in its understanding and its treatment. See, for today, if I ask my patient, how are you doing in terms of your diabetes? He will say, my diabetes is under control. You hear the statement all the time, my diabetes is under control. So I tell him, no, your sugar is under control. Diabetes is a disease in which one of the manifestations is a high sugar. So what we are controlling is your sugar. We are not controlling your diabetes. It is impossible to control your diabetes. I hope I'm making sense to you, because what I'm trying to emphasize to you is that controlling your sugar reduces certain complications of diabetes. Now, what are the complications that we reduce by simply controlling your sugar? By controlling your blood sugar, you reduce the eye complications. You know, diabetes leads to blindness and all kinds of problems with the eyes, and it leads to kidney problems. The kidneys start leaking protein in the urine, and the kidney function starts deteriorating. These are all directly related to your blood sugar control. Having said that, nobody dies of blindness. You don't die. You might lose your eyesight, but you don't die. Okay? And to die of kidney disease will take you decades before your kidneys fail. And if they fail, you'll go on to a dialysis. Okay? So you're still, it's not a death sentence. However, the other complications of diabetes, heart disease, people are constantly getting heart attacks or are dying of heart failure, or they're developing strokes and they're dying of strokes. Those are not related to the control of blood sugar. You see where I'm coming from? So, controlling your sugar, excellent, you must do it because it will protect your eyes, protect your kidneys. But it's not the whole story. All these years, we have fooled ourselves, we have fooled medical science, and we have fooled our patients by saying, hey, we have controlled your blood sugar, celebrate. There was some cause for celebration, but very, very small cause for celebration because we could not protect them from the other heart disease, this, that, and the other. Suddenly, few medicines came out which controlled cholesterol, for example, statin. Then medicines came out which could very beautifully control blood pressure and also help diabetes a bit. So they were called angiotensin receptor blockers, ACE inhibitors, whatever they were. So by using those medicines, the risk of heart disease came down 30%. So that was wonderful. So we were all very excited, very happy. 30% heart disease has come down, 30% less heart failure, 30% less stroke. Wonderful. But still there was 70% left. Right? So people were still dying and still having major complications. So we said, what are we going to do about this? And then, as luck would have it, or as science advanced, along came another group of drugs. And that is the revelation of the decade, if I may say so, because it has turned the whole treatment of diabetes around. And now we have this group of drugs which drop the risk of dying from diabetes by 40% more. Okay, so now you have a huge reduction in the risk. Control your sugar, use these other drugs that I mentioned before. Now you have this new group of drugs which are called Sglt2 inhibitors, big name, but I'll give you the generic names that you might be used to. You know, this group and another group of drugs which is called GLP-1 agonists. If you use these drugs, you're dropping the risk by 40%. And I think that is a cause for celebration. It is the most fantastic advance that this medical science has seen in the last 50 years. So those of you who have diabetes and who are seeing your doctors, please beg of them to give you these drugs. Give you Sglt2 inhibitors or GLP-1 agonists, assuming that you can be given these drugs safely, because in certain small groups we can't give it for other reasons. But assuming you can give it, 95% of people with diabetes should be given these drugs because they are going to protect you very, very hugely from the ravages of diabetes.
We have a question from Yusufi who says, I've done with a bypass in 2003. Last 3 months, I have pain in left shoulder. I'm taking a painkiller, so please advise further medical treatment and medicines.
Well, we'll have to get to the bottom of what is the cause of that pain. Okay. If you get pain when you walk, or if you get pain when you climb stairs in your left shoulder, which disappears when you rest a little bit, then the chances are you have heart pain or angina. But if the pain in the shoulder is provoked by movement or aggravated by movement, then it's likely to be a local issue. Maybe you have a frozen shoulder or something to that effect. So you would need to be evaluated. So your doctor would need to examine you, examine the shoulder. And if he suspects that it may be related to the heart, then you would need some other test, like maybe a 2D echo and a stress test, to try and find out whether there is an issue with your circulation. So I would say, please consult your doctor and let him evaluate that pain rather than just taking medicines without a diagnosis.
We have 3 questions which are on anxiety, and one of them is an interesting one. But first, Kailash asks, is anxiety a sign of heart problem? The other question which is there around anxiety is, I get very agitated on certain issues. Could that lead to a problem? I am suffering from high blood pressure. And the third question is, I recently read about a politician who suffered with a heart attack after he participated in a television discussion. I do get excited and anxious when I watch television discussions. Is that something I need to be worried about?
Well, anxiety is something that everybody should be worried about, because when you get unnecessarily anxious, it is called pathological anxiety. Certain amount of anxiety is physiological. For example, as students, when we went for an examination, the heart would go a little faster, you'd get butterflies in your tummy, you'd breathe a little faster, your mouth would get dry. That is physiological anxiety. But if the anxiety goes beyond certain limits, you will find your heart racing away. People have come to the hospital with a heart rate of 170, 170, and the blood pressure 200, 200 by 120. And all they have had is an argument with the wife or an argument with their partner or something of that sort, and that has driven them quite crazy, and the blood pressure has shot up. So if it does happen that way, then you are at risk, because your system is suddenly overburdened with a faster heart rate and a higher blood pressure. So yes, it could produce all kinds of problems. So if you suffer from pathological anxiety or debilitating anxiety, then in that case, you need to be treated. And the treatment is twofold. One is, of course, counseling. And today, a new type of counseling is being used for anxiety. It is called cognitive behavior therapy. So your therapist will teach you about cognitive behavior therapy, and it gives wonderful results. The results take about 3 weeks to a month to start kicking in as you practice cognitive behavior therapy. In the interim, your doctor would give you some medication which would drop the anxiety levels dramatically, and you take those medicines for 3-4 weeks until the cognitive behavior therapy starts kicking in, and then these medicines are withdrawn. So should anxiety be treated? Answer is yes, particularly if it's causing severe rises in pulse rate or high blood pressure. You absolutely should treat anxiety. For lesser degrees of anxiety, meditation, yoga are the best ways of dealing with it. Okay, so you have to decide depending upon your anxiety level, or ask your doctor what he thinks, etc. But we have good medicines if required. Otherwise, counseling and cognitive behavior therapy is the way to go.
And the other thing about participating in debates, watching television, causing anxiety.
Well, I mean, if it causes you anxiety, then you have to avoid that. You have to avoid that. So there's nothing else that you can do.
We have a question from Agnello Fernandez, who says, Dr. Borges, is 120 by 80 the perfect BP for all age groups?
Yes and no. 120 by 80 would be very high if you're 10 years old. So not all age groups, but if you're an adult, then 120 by 80 should be your target. But we have widened that now. We can say up to 130, 135 by 80, 85 is fine. So you don't have to target 120 by 80. However, let me expand my answer just a wee bit. Supposing you have, diabetes for many years, and you have a high cholesterol, which are further aggravating your problem with high blood pressure, then I would want to lower my blood pressure to as low a level as I can possibly get it. So I would probably lower it to 110 by 70. And I would get my HbA1c, glycosylated hemoglobin, to under 7. And I'd get my LDL cholesterol down to 35. So I would make use of these numbers to reduce my risk to as low a level as I can possibly reduce it.
So just two questions. One is responding to, I think your first question, what would be the cost of a pacemaker that you spoke about? This is from Vivian Pereira.
Well, there are different kinds of pacemaker. I was talking about an AICD, which is a defibrillator. Okay, the top of the line one would cost about 8.5, 9 lakhs of rupees. That is only for the device. At the bottom of the range, probably 4 lakhs of rupees. It's like buying a car. You can buy an Ambassador or a Fiat, or you can buy a Mercedes. But we don't look at we look at the actual need for a sophisticated device. If your problem needs a very sophisticated device, then of course the cost would go up. But if your problem can be sorted out with a less sophisticated device, the cost would be around 4 to 5 lakhs for the device. So we'll have to individualize it. I can't give you one
this
answer.
This is a question which is again would appeal to everybody. I'm 60. How often should I get an ECG done?
You laugh at my answer. I would tell you that an ECG is worse than useless. Okay. I don't think that an ECG per se tells you anything. Okay. It is not a Janam Patrika. It doesn't look in the future. It may tell you something about your past, but it tells you about the present. So right now, while the ECG is being taken, you don't have a heart attack. You're not having a heart attack while we speak, while I'm taking the ECG. It doesn't tell you whether you're going to have a heart attack tomorrow. It may tell me that you may have had a heart attack in the past, but that you may know already. So an ECG doesn't give you too much information if you do it as a routine. However, if I'm getting chest pain and I go to a doctor and I say, look, I'm getting chest pain. Right now I have chest pain. He takes an ECG. Your ECG is normal. Chances are you don't have a heart trouble at that point in time. Okay. So I don't think things like routine ECGs make any sense whatsoever. I would do my routine biochemistry to make certain my risk factors are under control. I would do my blood pressure. And once in 2-3 years, I would do what is called a stress evaluation, a stress test. Go onto a treadmill and do an exercise ECG. That is much more informative than a lying down static ECG. Okay.
We have a question from, I'm sorry, if I mispronounce your name, Gucci Ramasarma Ramapalli. Says, Doctor, I heard that persons above 70 years of age are less likely to get heart attacks. Is it true?
Well, there are these statistical aberrations that have been published. They say that if you reach the 7th decade of your life, you're protected until you're 80. And after 80, you'll have trouble. These are all statistical aberrations, ma'am. I don't think a disease looks at your age. Okay, just like the COVID virus doesn't look at your age, it catches everybody. At a later age, if you have trouble with the virus, you're likely to have more morbidity and mortality. So it's not true that if you reach 70, you're not going to get a heart attack. No, that's not true. These are statistical aberrations.
This is a question which is, Doctor, you said you also read, you are also a senior citizen. What are the overall dietary habits that you have? How do you ensure that you ward off danger?
You mean about my diet?
About your diet, and how do you ensure that you ward off danger?
Well, as I said, you have to eat sensibly. I eat, well, like I told you that the best diet to have is a Mediterranean diet. So I try to be as Mediterranean as possible. I do indulge now and then in various things which are supposed to be no. After all, I am human, and I'm sure my patients are also human. But the important thing is, at the end of the day, at the end of 3 months or 4 months or 5 months, whatever you say, your average readings should be perfect. If they are, little indulgences here and there are fine. So that's why we always talk about averages. Okay. So your HbA1c, for example, if your average of 3 monthly average is showing it's less than 7, you are wonderful. Your blood sugars are well controlled. Okay. Similarly, if your blood pressures, if you check them every week, at random, and you find they're perfectly normal, that's great. Do your cholesterol once in every 4-5 months. If they are normal, great. That's the way to go about it. Exercise as much as you can. Aerobic. If you can swim, that's the best form of exercise. A senior citizen should not jog because you'll damage your joints and end up with knee issues and hip issues and ankle issues, which you want to avoid. I think walking is the best form of exercise, but if you know how to swim, that's the best that you can do. Do not jog, please. And if you do that, I think you're well on the way to leading a very healthy life insofar as you can.
Doctor, this is a question which has been asked, and this is the last question. I'm sorry, Harjeet, Rikhi, Anand, K, Ajit Kumar, Menon, Makul Madachi, some of your questions I've not been able to answer, and also some of the questions that have come in from people who are not seniors, I have chosen not to answer because there are just so many questions. This is the last question which I have, is that in this period of COVID and the scare that is there, I'm a little worried about going to a doctor's clinic. Is telemedicine an appropriate thing for a cardiac check?
Let me answer this question in two parts. If this question was put to me by one of my own patients whom I have evaluated over the years and whom my condition I know, I could tell him probably yes, I could manage you with telemedicine because I know the baseline case pretty well. But if I haven't seen the person before, I do not encourage telemedicine for those patients, particularly if they have issues with heart function. Because in order to diagnose that the heart function has gone down, you got to examine the patient physically. You got to listen with your stethoscope. You got to listen to the heart sounds. You got to listen to the lungs, and then arrive at a conclusion as to whether this person is stable or not stable. So those kind of patients know high blood pressure, and you want to have his blood pressure controlled. Yes, we could very easily do that on telemedicine because now with home monitoring units available for blood pressure, you can keep a chart. We can adjust the medicines during a telemedicine consultation, and you can continue to monitor, and we could share those readings and then decide about control. You could get your blood test done, etc., and then we could share those on telemedicine. And so controlling blood pressure, controlling blood sugars, taking care of all that on telemedicine, absolutely possible. But those who are in delicate situations, I don't think telemedicine is a great idea, and I think it's better to actually physically show up at a doctor's office and get him to examine you.
Thank you very much, Dr. Borges, for your time. You've spent
not at all. I hope it was informative, and I hope it made sense to the audience. Okay.
Absolutely, it was very informative, and thank you very much, Dr. Eric Borges. It was great having you here.
My pleasure. My pleasure.